Question 1. A client has been diagnosed with borderline personality disorder and frequently uses splitting as a defense mechanism. Which of the following is the best way the social worker should address this behavior in the therapeutic relationship? A. Immediately point out the splitting behavior and confront the client's manipulation to foster insight. B. Consult with the supervisor, maintain consistent boundaries, and ensure clear communication with all team members to present a unified front. C. Terminate the relationship if the client attempts to idealize the social worker while devaluing the supervisor or other staff members. D. Ally with the client when they describe a staff member as all bad to validate the client's feelings and build rapport. Answer. B. Consult with the supervisor, maintain consistent boundaries, and ensure clear communication with all team members to present a unified front. This question tests the concept of managing the defense mechanism of splitting, often seen in borderline personality disorder, with the keyword best, requiring a priority intervention. Splitting involves seeing people or situations as either all good or all bad, and the most crucial therapeutic response is to counteract this by modeling integration and consistency. The social worker must maintain clear, consistent boundaries and collaborate with the entire treatment team to prevent the client from successfully creating divisions among staff. For instance, if a client praises the social worker but calls the psychiatrist incompetent, the social worker calmly validates the client's feelings while reinforcing the value of the team's consistent approach. A good takeaway is that consistency and a unified front are the core strategies when managing clients who use splitting, as this promotes integration rather than division. Question 2. A social worker in a community mental health clinic is conducting an intake assessment with a 45-year-old client who reports feeling a persistent lack of meaning in life, stagnation, and a sense of having contributed little to the world. According to Erikson's psychosocial stages of development, which crisis is the client most likely navigating? A. Identity versus role confusion. B. Intimacy versus isolation. C. Generativity versus stagnation. D. Integrity versus despair. Answer. C. Generativity versus stagnation. This question tests knowledge of Erikson's 8 stages of psychosocial development, and the clue keywords lack of meaning, stagnation, and contributed little point directly to the central conflict of middle adulthood. Generativity involves finding a way to contribute to society, typically through raising children or productive work, while stagnation is the failure to find this purpose. In contrast, the other stages focus on different life periods, such as adolescence, identity versus role confusion, or old age, integrity versus despair. A practical example is a client who, after years of a stable job, now feels restless and seeks to volunteer or mentor young people to achieve generativity. Here is an easy way to remember it. Think of generativity as generating value or leaving a legacy for the next generation. Question 3. A social worker receives a valid subpoena requesting a client's records. The client is competent and has not given written consent for the release of information. What is the social worker's next action? A. Immediately send the requested records to the court or attorney who issued the subpoena to avoid being held in contempt. B. Assert privilege. Contact the client to discuss the subpoena and consult with legal counsel regarding how to respond. C. Contact the court to challenge the validity of the subpoena, arguing it violates the client's right to privacy. D. Inform the client that the subpoena is legally binding and the records will be released within 5 business days. Answer. B. Assert privilege. Contact the client to discuss the subpoena and consult with legal counsel regarding how to respond. This question tests the ethical and legal protocol for responding to a subpoena using the keyword next to prioritize the immediate action. The social worker's ethical duty is to protect client confidentiality by asserting privilege, which means refusing to release the information unless compelled by a court order or receiving written consent. Even with a subpoena, a court order is usually required to override privilege, so the social worker must discuss the situation with the client and seek legal guidance before releasing any records. For instance, the social worker might assert privilege and then request a protective order from the court to shield the records. Remember this core principle. A subpoena is not the same as a court order, and the social worker must always assert privilege and protect the client's confidentiality until legally required otherwise. Question 4. A client who struggles with a long history of substance use reports that they stopped attending community support meetings because the other attendees were too weak and their stories were pathetic. This statement is most indicative of which defense mechanism? A. Isolation of effect. B. Sublimation. C. Intellectualization. D. Reaction formation. Answer. D. Reaction formation. The concept tested here is the defense mechanism of reaction formation, and the keywords suggest a client is expressing the opposite of what is likely their unconscious feeling. Reaction formation occurs when an individual unconsciously converts an unacceptable or dangerous impulse into its opposite acceptable form, such as masking deep feelings of vulnerability, fear of relapse, or weakness, by loudly criticizing it in others. The client is likely projecting their own fears of being weak onto the group members, and then reacting against that fear by taking an opposite, highly critical stance. For example, a person who is secretly attracted to a forbidden person may become aggressively hostile toward that person to deny the feelings. Here is an easy way to remember. Reaction formation is acting the opposite of what you truly feel or fear. Question 5. A social worker is conducting an initial assessment with a 28-year-old client who reports chronic job dissatisfaction, difficulty maintaining stable relationships, and often relies on their parents for financial and emotional support. Applying a systems theory perspective, the social worker determines that the client's family system is most likely characterized by A. Equifinality, where the family achieves the same outcome through different starting points. B. Morphostasis, where the system has an excessive tendency toward stability and resists necessary change. C. Homeostasis, where the system has adapted to its current functional state. D. Differentiation of self, where family members maintain emotional autonomy. Answer. B. Morphostasis, where the system has an excessive tendency toward stability and resists necessary change. This question tests the application of concepts from family systems theory and the keywords difficulty maintaining stable relationships and relies on their parents suggest a rigid, stuck family structure. Morphostasis describes a system's ability to remain stable in the face of change, and in a dysfunctional family, this often means the system rigidly resists the client's move toward independence, keeping the client emotionally immature. For instance, the family might unintentionally sabotage the client's job prospects or new relationships to keep the family structure unchanged. The social worker should view the client's symptoms as a sign that the family is stuck in a pattern of resisting necessary growth and evolution, which is what morphostasis refers to. Question 6. A social worker is leading a psychoeducational group for clients recently diagnosed with bipolar I disorder. A participant asks for the main difference between first-generation, typical, and second-generation, atypical, antipsychotic medications. The social worker should explain that the second-generation medications are characterized by A. A higher risk of causing tardive dyskinesia, involuntary movements, and other extrapyramidal symptoms. B. Lower overall efficacy in managing the positive symptoms of psychosis. C. Primarily acting on dopamine receptors, but also affecting serotonin receptors. D. Being prescribed only for clients who have failed to respond to mood stabilizers like lithium. Answer. C. Primarily acting on dopamine receptors, but also affecting serotonin receptors. This question tests knowledge of psychopharmacology, specifically the difference between generations of antipsychotics. Second-generation, atypical, antipsychotics are distinguished by their dual action on both dopamine and serotonin receptors, which is believed to reduce the risk of severe movement disorders associated with first-generation, typical, antipsychotics. First-generation antipsychotics primarily block dopamine and are associated with a higher risk of extrapyramidal symptoms, EPS, including tardive dyskinesia, A common example of a second-generation antipsychotic is risperidone. The key takeaway is that the term atypical essentially means these drugs act on both dopamine and serotonin, which is their primary benefit over older medications. Question 7. A 32-year-old male client is struggling to form an authentic, intimate relationship, reporting that he feels lonely but also fears the vulnerability required for closeness. According to Erikson stages, this client is struggling with the developmental task of A. Trust versus mistrust. B. Autonomy versus shame and doubt. C. Intimacy versus isolation. D. Identity versus role confusion. Answer: C. Intimacy versus isolation. This question tests knowledge of Erikson's psychosocial stages and the keywords struggling to form an authentic, intimate relationship, lonely, and fears the vulnerability clearly point to the young adult stage. The central crisis of young adulthood is intimacy versus isolation, where the person is working to form deep, committed relationships with others. In contrast, the identity versus role confusion stage occurs during adolescence and focuses on establishing a sense of self. When the client fails to achieve intimacy, they experience isolation. An example of a successful resolution is when a person moves from casual dating to a long-term, committed partnership. The way to remember this is to connect intimacy with the ability to form mature, close relationships in young adulthood. Question 8. A social worker is conducting the first session with a court-mandated client who is visibly angry and states, "I don't need to be here, and you can't help me." What is the social worker's most important initial action? A. Confront the client's resistance by explaining the mandatory nature of the court order and the potential consequences of noncompliance. B. Shift the focus immediately to completing the required biopsychosocial assessment to gather necessary information. C. Acknowledge the client's feelings of anger and powerlessness and collaboratively explore what the client hopes to gain, if anything, from the process. D. Terminate the session immediately and inform the referral source that the client is unready for treatment. Answer: C. Acknowledge the client's feelings of anger and powerlessness and collaboratively explore what the client hopes to gain, if anything, from the process. This question is a first, next, best, most item testing the priority of engagement with a resistant client. The keyword most important initial action must focus on building rapport and reducing resistance before any substantive work can occur. In engagement, the social worker must first accept the client's feelings and attempt to find any common ground, known as starting where the client is. For example, the social worker might say, "It sounds frustrating to be here against your will. What is one thing we could work on that might make this process less painful for you?" The key takeaway is to always prioritize acknowledging a client's resistance and finding a shred of motivation before launching into assessment or intervention. Question 9. In the context of the 2025 ASWB updates, a social worker is providing telehealth services to a client who moves out of state. What ethical and legal requirement must the social worker prioritize immediately? A. Documenting the change of address in the client's chart and adjusting the billing code for out-of-state services. B. Consulting with the supervisor and researching the licensure laws of the new state before providing any further clinical services. C. Immediately terminating services as a social worker's license is only valid within the state of issue. D. Ensuring the client signs a new telehealth consent form acknowledging the risks of remote services. Answer: B. Consulting with the supervisor and researching the licensure laws of the new state before providing any further clinical services. This question addresses the ethical and legal challenges of telehealth, a key area in recent ASWB updates, with prioritize immediately, requiring the first crucial step. A social worker's license grants the authority to practice only within the licensing state, so providing services across state lines is usually illegal unless specific interstate agreements or the new state's laws permit it. Therefore, before continuing therapy, the social worker must consult and research the new jurisdiction's laws to ensure compliance or arrange a referral if necessary. A practical example is a social worker who must stop sessions with a client who moves from Washington State to Oregon until the laws of both states are checked for compliance. The crucial takeaway is that a social worker's jurisdiction is determined by the client's physical location, making out-of-state practice a legal issue that must be resolved first. Question 10. A social worker has been providing short-term, task-centered therapy to a client experiencing job loss and financial stress. The client has successfully completed all identified tasks and expressed feeling ready to terminate. However, the social worker notes the client is now subtly shifting back to discussing irrelevant past history and asking about the social worker's personal life. The social worker should first A. Gently confront the client on the resistance to termination by reminding the client of the original task-centered goals. B. Reassess the client for a new set of goals, as the client's new focus on history and personal questions indicates an underlying, unaddressed issue. C. Validate the client's feelings about the ending of the relationship and explore their feelings related to loss and independence. D. Explain the ethical prohibition against dual relationships when the client asks about the social worker's personal life. Answer. C. Validate the client's feelings about the ending of the relationship and explore their feelings related to loss and independence. This is a first, next, best, most item focused on the termination phase of therapy, and the client's subtle shift to irrelevant topics signals anxiety and resistance to the ending. The most appropriate first action is to recognize the client's behavior as a sign of normal termination grief or anxiety and address the emotional process head-on. By validating the client's feelings about loss and independence, the social worker helps the client process the ending in a healthy way. For example, the social worker might say, "It sounds like saying goodbye is harder than we expected. Let's talk about what the ending of our work means to you." The essential takeaway is that processing feelings of loss is the central task of termination, and resistance often appears when the client is struggling with these feelings. Question 11. A social worker in private practice is mandated to use a standardized biopsychosocial assessment tool for all new clients. The client reports that the standardized questions do not seem relevant to their current difficulties, which are primarily related to recent cultural displacement. What is the best practice for the social worker in this scenario? A. Document the client's statement in the record and continue with the standardized tool, as it is a mandated requirement of the practice. B. Discontinue the use of the standardized tool and instead use a culturally sensitive, unstructured assessment method. C. Integrate a formal cultural assessment or cultural formulation interview into the standardized process to gather relevant information. D. Focus the standardized assessment only on the client's strengths and avoid asking any questions about culture or history to prevent offense. Answer. C. Integrate a formal cultural assessment or cultural formulation interview into the standardized process to gather relevant information. This question tests the ethical and clinical practice of balancing mandated procedures with cultural competence, a key area of the NASW examination. The keyword best practice requires the social worker to follow the mandate while prioritizing the client's cultural reality, and the goal is to fully understand the client's complaint within their cultural context. Therefore, the social worker should comply with the standardized tool, but supplement it with a formal cultural assessment, such as the cultural formulation interview from the DSM-5, which directly addresses how culture impacts the client's perspective and distress. A practical example is asking the client, "How would your family or community describe your problem?" to gather information that the standardized tool missed. A helpful tip is that in social work, the best answer almost always integrates mandatory clinical requirements with cultural humility. Question 12. A social worker is conducting a lethality assessment on a 17-year-old client. Which of the following is the most significant risk factor, requiring the social worker to prioritize immediate crisis intervention and safety planning? A. History of non-suicidal self-injury, NSSI, in the past 2 years. B. Feelings of hopelessness, which the client reports have been present for 6 months. C. Specific plan to overdose on a sibling's medication with the medication currently available in the home. D. Diagnosis of major depressive disorder and reported use of alcohol on weekends. Answer. C. Specific plan to overdose on a sibling's medication with the medication currently available in the home. This is a critical, most significant prioritization question focusing on suicide risk assessment. The most crucial factors indicating immediate danger are the presence of a specific plan, means available, and intent to carry out the plan, which is what option C describes. While risk factors like hopelessness, B, and a history of self-injury, A, increase the overall risk. A concrete plan with immediate access to the method, lethal means, is the strongest indicator of imminent danger. An example is when a client has a clear plan, like driving into a wall, and has already put the car keys in their pocket. Always remember that the presence of a specific plan plus available means trumps all other chronic risk factors and requires immediate action. Question 13. Which of the following is the best example of the defense mechanism of sublimation?
A.
A client who is angry at their boss goes home and snaps at their spouse. B. A client who is abused as a child joins the police force to arrest child abusers. C. A client who has an aggressive personality starts a career as a professional boxer. D. A client who fails an exam insists that the exam was unfair and poorly written. Answer. C. A client who has an aggressive personality starts a career as a professional boxer. This question tests the defense mechanism of sublimation, which is widely considered one of the most mature and constructive defense mechanisms. Sublimation involves channeling unacceptable impulses, drives, or conflicts, like aggression, into socially acceptable and constructive activities, like professional boxing or art. This differs from displacement, snapping at a spouse, which redirects the impulse to a safer but still inappropriate target. For instance, a person with excessive sexual energy dedicating their life to painting sexually suggestive, but critically acclaimed, artwork is using sublimation. The key takeaway is that sublimation is the only defense mechanism that results in a productive, socially positive outcome. Question 14. A social worker is leading a therapeutic group and notices that two members, who initially bonded closely, have begun to exhibit intense hostility toward the social worker's co-leader, criticizing her suggestions while praising the primary social worker. The social worker should conceptualize this dynamic as
A.
Collective resistance to the group process. B. Negative countertransference to the co-leader. C. Group splitting and transference onto the leaders. D. Sublimation of individual aggression. Answer. C. Group splitting and transference onto the leaders. This question tests the conceptual understanding of complex group dynamics, specifically combining transference and the defense mechanism of splitting. Splitting occurs when the group unconsciously divides the leaders into all good, the primary social worker, and all bad, the co-leader, which is an attempt to manage anxiety and is a form of group resistance. Transference is the unconscious redirection of feelings from a significant past relationship onto the therapist or co-leader. The social worker should view this as a form of resistance where the group avoids dealing with the underlying conflicts by projecting them onto the co-leader. The way to address this is for both leaders to maintain a united front and calmly address the dynamic in the group. Question 15. A social worker is providing psychoeducation to a client who has recently been prescribed fluoxetine Prozac for depression. The social worker should advise the client that the medication is an SSRI, selective serotonin reuptake inhibitor, and that one common side effect that may be noticed early in treatment is
A.
Hypertension, high blood pressure. B. Sexual dysfunction and gastrointestinal upset. C. Tremors or Parkinsonian-like symptoms. D. Rapid weight gain and increased appetite. Answer. B. Sexual dysfunction and gastrointestinal upset. This question tests the social worker's essential knowledge of psychopharmacology, specifically common side effects of SSRIs. Selective serotonin reuptake inhibitors work by increasing the amount of serotonin in the brain, and the most commonly reported initial side effects are nausea, diarrhea, and other gastrointestinal issues, along with sexual dysfunction, which can persist throughout treatment. The social worker must inform the client of these effects so they do not discontinue the medication abruptly, as they typically subside after a few weeks, except for sexual side effects. For example, a client may report stomach cramps or diarrhea when first starting the medication. Remember to tell clients that gastrointestinal issues and sexual dysfunction are two of the most frequent side effects of SSRIs. Question 16. A social worker is supervising an unlicensed intern who is seeking advice on how to manage a dual relationship boundary issue. The intern reports that a client, who is a talented local artist, offered the intern a high-value painting as a gift after successful termination. What should the social worker advise the intern to do next?
A.
Accept the painting to honor the client's cultural gesture of thanks, but only after seeking written approval from the clinical director. B. Firmly decline the gift, explaining that accepting an expensive gift creates a dual relationship, and refer the client to a professional art gallery. C. Decline the gift, explaining the ethical standard against accepting expensive gifts, and explore the meaning of the gift with the client as a final therapeutic act. D. Accept the painting but immediately donate it to a local charity to avoid a conflict of interest, ensuring the client knows where it was donated. Answer. C. Decline the gift, explaining the ethical standard against accepting expensive gifts, and explore the meaning of the gift with the client as a final therapeutic act. This question tests the ethical protocol regarding boundary issues, specifically accepting gifts from clients, and requires the next priority action. While the intern must decline the high-value gift to prevent a dual relationship and boundary violation, the refusal must be framed therapeutically, without simply cutting off the client's gesture of thanks. The social worker should help the intern understand that they must explain the ethical standard and then process the underlying meaning of the client's gesture as part of the termination process. The key takeaway is that when declining a gift, the social worker must maintain the therapeutic relationship by gently exploring the meaning behind the client's gesture. Question 17. A 68-year-old client with no prior mental health history presents with new onset, fluctuating cognitive impairment, disorientation, and extreme restlessness after a recent hospitalization for a medical issue. The client's family reports the symptoms worsen at night. The social worker should first recommend a medical consultation to rule out which condition?
A.
Major neurocognitive disorder, dementia. B. Delirium. C. Schizophrenia, late onset type. D. Illness anxiety disorder. Answer. B. Delirium. This question tests the social worker's ability to differentiate between cognitive disorders, using the keyword first to prioritize ruling out a medical cause. Delirium is characterized by a sudden onset of fluctuating or acute changes in attention and awareness, which often worsens in the evening, sundowning, and typically results from a medical condition, medication, or substance withdrawal. Since the client is elderly and recently hospitalized, the symptoms are highly suggestive of delirium, which requires immediate medical attention and is a top priority to rule out before considering a primary psychiatric disorder. A key distinction is that major neurocognitive disorder is characterized by a gradual onset, while delirium is acute and fluctuating. The primary action is always to rule out a medical cause when psychiatric symptoms have an acute onset. Question 18. A social worker specializing in macro practice is hired by a community to address a high rate of violent crime. The social worker's initial effort is to facilitate meetings between residents, police, and local government to increase collaboration and community safety efforts. The social worker is operating under which model of community practice?
A.
Social planning. B. Locality development. C. Social action. D. Social learning. Answer. B. Locality development. This question tests knowledge of macro social work models, and the keywords facilitate meetings, residents, police, and local government, and increase collaboration are the primary clues. Locality development, or community development, focuses on fostering community participation, collaboration, and self-help to achieve goals. The social worker acts as a facilitator and enabler, bringing disparate groups together to find common ground and solve problems at the local level. Social planning, by contrast, emphasizes a technical, expert-driven approach, and social action focuses on confrontation and social justice to challenge power structures. The easy way to remember this is that locality development is about local collaboration and shared community power. Question 19. A social worker is conducting a psychosocial assessment of a 16-year-old client. The client exhibits highly rigid, black and white thinking, struggles to consider viewpoints other than their own, and demonstrates an inability to grasp hypothetical concepts. According to Piaget's stages of cognitive development, the client's current cognitive limitations are most characteristic of which stage?
A.
Sensor-motor. B. Preoperational. C. Concrete operational. D. Formal operational. Answer: C. Concrete operational. This question tests knowledge of Piaget's stages of cognitive development, with the clue keywords pointing to the limitations in abstract thought. The concrete operational stage, roughly ages 7 to 11, is characterized by logical thinking about concrete, tangible events, but an inability to engage in abstract reasoning, consider hypotheticals, or think systematically about possibilities. While the client's age, 16, suggests they should be in the formal operational stage, abstract thought, the limitations described indicate a cognitive delay or functioning characteristic of the concrete operational stage. An easy way to remember it is that concrete means they can only grasp what is right in front of them and struggle with what-if scenarios. Question 20. A couple is in counseling after the husband had an affair. The wife repeatedly states, "I know the affair wasn't my fault, but I keep going over every moment of our marriage to figure out what I did to make him cheat." This pattern of thought is most indicative of which defense mechanism?
A.
Rationalization. B. Intellectualization. C. Denial. D. Projection. Answer: B. Intellectualization. The concept tested here is the defense mechanism of intellectualization, and the keyword, going over every moment to figure out the cause, suggests excessive use of logic and abstraction to avoid the pain. Intellectualization is the process of avoiding the emotional content of a difficult situation by focusing exclusively on the factual, logical, and abstract details. In this case, the wife is using her intellect to analyze the marriage history as a way to avoid the intense, painful feelings of betrayal, anger, and grief. The easy way to remember the distinction is that intellectualization is characterized by overanalysis and a detachment of feeling from the facts. Question 21. A social worker is preparing for an initial consultation with a client who is mandated to attend due to a protective order resulting from alleged child neglect. To promote engagement, the social worker should first focus on
A.
clarifying the court's expectations and the consequences of noncompliance with the treatment plan. B. Reviewing the legal report with the client to assess their understanding of the allegations. C. Exploring the client's perception of the current situation and the impact of the protective order on their life. D. Explaining the concept of self-determination and the client's right to choose the focus of the treatment. Answer: C. Exploring the client's perception of the current situation and the impact of the protective order on their life. This is a first, next, best, most question about the priority of engagement with a mandated, potentially hostile client. The critical first step is starting where the client is by exploring their subjective experience and how they view the situation, rather than immediately focusing on legal mandates or clinical assessment. By asking about the client's perception and the impact of the protective order, the social worker conveys respect and builds a tentative alliance, which is crucial for rapport. For example, the social worker might say, "This must be a difficult and stressful time for you. Tell me how this court order has changed things at home." The core guideline is that the social worker must prioritize validation and listening to establish a working relationship before moving to assessment or compliance issues. Question 22. A social worker is using cognitive behavioral therapy, CBT, with a client who believes, "If I don't do something perfectly, I am a total failure." The social worker has collaboratively identified this as a core dysfunctional thought. The next step in the CBT intervention should be to
A.
use a thought record to help the client identify the specific situation that triggers the thought, the associated emotion, and the resulting behavior. B. challenge the cognitive distortion by asking the client for evidence that supports and refutes the thought, a technique known as Socratic questioning. C. Introduce relaxation and breathing techniques to manage the anxiety resulting from the core belief. D. Terminate the session as the client has achieved sufficient insight by identifying the core belief. Answer. B. Challenge the cognitive distortion by asking the client for evidence that supports and refutes the thought, a technique known as Socratic questioning. This question tests the procedural steps of cognitive behavioral therapy, CBT, and requires the next logical intervention after a dysfunctional thought, I am a total failure, is identified. Once the core belief is identified, the next step in CBT is to actively challenge the validity of that thought using Socratic questioning, which is a key technique for cognitive restructuring. This involves collaboratively examining the evidence for and against the thought, like asking, can you think of any time you did something well, but not perfectly? The thought record, A, is typically used earlier to identify the connections, and relaxation, C, is a separate skill, not the primary cognitive restructuring step. Remember that the core of CBT is challenging and changing the cognitive distortions through methods like Socratic questioning. Question 23. A social worker is assessing a client who has been diagnosed with schizophrenia. The client exhibits flat affect, alogia, poverty of speech, and avolition, lack of motivation. These symptoms are classified in the DSM-5 as
A.
Positive symptoms, because they are abnormal additions to normal functioning. B. Negative symptoms, because they represent a reduction or absence of normal functions. C. Cognitive symptoms, because they directly interfere with thought processes. D. Disorganized symptoms, because they reflect a breakdown in the logical connections of thought. Answer. B. Negative symptoms, because they represent a reduction or absence of normal functions. This question tests the essential diagnostic knowledge of the symptom classification in schizophrenia. Negative symptoms are defined as the absence or reduction of normal mental functions and include common examples like flat affect, lack of emotional expression, alogia, lack of speech, and avolition, lack of motivation or goal-directed behavior. Conversely, positive symptoms are the presence of abnormal additions to functioning, such as hallucinations or delusions. A simple way to remember this is that positive symptoms add something, like hallucinations, while negative symptoms take something away, like motivation. Question 24. A client reports to the social worker that their manager at work is constantly criticizing their performance, causing the client intense stress. The social worker suggests the client document every time the manager criticizes them over the next week and track the specific context, frequency, and content of the criticisms. This technique is an example of which of the following?
A.
Paradoxical intent. B. Prescribing the symptom. C. Behavioral homework/monitoring. D. Cognitive reframing. Answer. C. Behavioral homework/monitoring. This question tests recognition of a common, fundamental technique used across various behavioral and cognitive behavioral therapies. The keyword document every time and track the specific context, frequency, and content describes a basic practice of self-monitoring or behavioral homework. Self-monitoring is the process where a client systematically records their behavior or thoughts, which helps increase client awareness, establish a baseline for assessment, and identify triggers and patterns. The other options refer to advanced or different intervention techniques, such as reframing the manager's criticism as a challenge, cognitive reframing. The takeaway is that assigning clients to track or count a behavior is always a form of monitoring or behavioral homework. Question 25. A social worker is providing brief, solution-focused brief therapy, SFBT, to a client who reports feeling overwhelmed by the problem. To help the client envision life after the problem is solved, the social worker asks, suppose tonight, while you are asleep, a miracle happens and the problem is solved. When you wake up, what would be the first small sign you would notice that tells you a miracle has occurred? This technique is known as the
A.
Scaling question. B. Coping question. C. Exception finding question. D. Miracle question. Answer. D. Miracle question. This question tests the specific techniques of solution-focused brief therapy, SFBD, and the scenario provides the exact script for the technique. The miracle question is a core intervention in SFBD used to help clients bypass problem-focused thinking and construct a detailed vision of their preferred future, which then helps identify specific, achievable goals. The scaling question asks clients to rate their experience on a scale of 1 to 10, while the coping question is used to find existing strengths when a client feels overwhelmed. Remember that the miracle question is designed to create a problem-free picture, even if only in fantasy, to help the client articulate a goal. Question 26. A 55-year-old client reports significant anxiety and stress related to their job and increasing debt. The social worker notes the client tends to respond to stress by taking on more responsibilities, buying new items, and constantly staying busy to avoid introspection. The social worker should conceptualize this behavior pattern as
A.
Externalizing coping strategy. B. Maladaptive interjection. C. Denial of core symptoms. A. Primary process thinking. Answer. Externalizing coping strategy. This question tests the social worker's ability to conceptualize coping mechanisms. The keywords taking on more responsibilities, buying new items, and constantly staying busy describe behaviors that direct attention and energy outward, away from internal feelings and thoughts. An externalizing coping strategy is a way of managing stress by focusing on the outside world, often to avoid painful or unacceptable internal emotional states. A contrasting internalizing strategy would be self-blame or withdrawing into oneself. The social worker should recognize that this external focus is a form of avoidance and a common, though often maladaptive, way to deal with stress. Question 27. A client in a psychiatric facility who has a history of trauma suddenly begins speaking in a voice like a small child and is unable to recall the events of the previous day, stating her name is Lily and she is 5 years old. The social worker should conceptualize this as a manifestation of
A.
Repression. B. Dissociation. C. Regression. D. Conversion. Answer. B. Dissociation. This question tests the concept of dissociation, which is a key symptom in various trauma-related disorders. Dissociation involves a disruption in the usually integrated functions of consciousness, memory, identity, or perception, and the keywords suddenly begins speaking in a voice like a small child and unable to recall the events are signs of a temporary identity shift or amnesia. While regression involves reverting to an earlier stage of behavior, dissociation is a severe disruption of identity and memory, often a way to mentally escape overwhelming trauma. For example, a client may feel outside of their body, depersonalization, which is another form of dissociation. The best way to remember it is that dissociation is a disconnection from the self, reality, or time. Question 28. A social worker is providing crisis intervention for a client who recently experienced a traumatic event. The social worker's primary goal during the initial phase of the crisis intervention process is to
A.
Help the client develop insight into the historical roots of their current emotional reaction. B. Reduce the client's sense of helplessness and restore a sense of equilibrium and control. C. Facilitate the client's ability to discuss the trauma narrative in detail to promote emotional catharsis. D. Refer the client to a specialist for a formal diagnosis of acute stress disorder or PTSD. Answer. B. Reduce the client's sense of helplessness and restore a sense of equilibrium and control. This is a first, next, best, most question focused on the primary goal of crisis intervention. The central purpose of crisis intervention is immediate stabilization, which means alleviating acute distress and returning the client to a state of emotional and behavioral equilibrium. Reducing the client's sense of helplessness is a direct way to restore a sense of control. Insight into historical roots. A is the goal of long-term therapy, not crisis intervention. The core task of crisis work is immediate safety and stabilization. Question 29. A social worker is conducting an assessment for a client with bipolar I disorder who has been prescribed lithium, A mood stabilizer? The social worker should advise the client that which of the following is essential to monitor while taking this medication?
A.
Consistent daily caloric intake to prevent rapid weight changes. B. Regular blood tests to monitor drug level and kidney function. C. Signs of tardive dyskinesia, such as involuntary movements of the face and tongue. D. Risk of life-threatening hypertension, high blood pressure. Answer. B. Regular blood tests to monitor drug level and kidney function. This question tests essential social work knowledge about the monitoring requirements for psychotropic medication. Lithium is a highly effective mood stabilizer, but it has a narrow therapeutic window, meaning the dosage required for treatment is very close to a toxic dose. Therefore, regular blood monitoring is essential to ensure the drug level is within the therapeutic range and to check for potential toxicity, which can damage the kidneys. For example, the social worker must stress that the client cannot abruptly change their fluid or sodium intake, as this can affect lithium levels. The critical takeaway is that clients taking lithium must have their blood levels and kidney function monitored regularly. Question 30. A social worker is providing supervision to a new colleague who reports feeling overwhelmed and emotionally depleted after working with several clients who have experienced severe trauma. The social worker should conceptualize the colleague's experience as
A.
burnout, which requires a medical leave of absence and a change in career path. B. Vicarious trauma or compassion fatigue, which requires self-care, boundaries, and consultation. C. Transference, where the colleague is internalizing the client's emotional experience. D. Secondary gain, where the colleague is benefiting from the attention associated with their emotional pain. Answer. B. Vicarious trauma or compassion fatigue, which requires self-care, boundaries, and consultation. This question tests the essential supervisory concept of vicarious trauma, also called compassion fatigue, which is a key topic in professional ethics and self-care. Vicarious trauma is the emotional and psychological distress resulting from repeatedly hearing and engaging with clients' traumatic experiences, leading to a shift in the helper's own worldview or sense of self. The appropriate response is to address it through professional consultation, boundary setting, and proactive self-care practices, rather than assuming immediate burnout. For example, the social worker might encourage the colleague to limit the number of trauma clients and practice mindfulness. The core professional guideline is that vicarious trauma is a normal occupational hazard that requires professional self-care and supervision. Question 31. A client with schizoaffective disorder has been receiving case management services for a year. The social worker learns that the client's father is a member of the local town council and has been quietly pressuring the agency's director to allocate additional funding to the client's program. The social worker should first address the ethical issue of
A.
conflict of interest, B. dual relationship, C. termination, D. informed consent. Answer. A. conflict of interest. This question tests the ethical concept of a conflict of interest, with a keyword first, requiring the social worker to identify the immediate ethical problem. A conflict of interest occurs when a social worker's professional judgment concerning a client is, or could be compromised by an outside, secondary interest, which in this case is the potential benefit of increased funding influenced by the client's relative. The social worker must address the possibility that the director or the agency's decisions regarding the client's care could be unduly influenced by the client's father's position. This ethical issue is not a direct dual relationship between the social worker and the client, but rather an indirect conflict affecting the whole agency. The primary goal is to maintain objectivity and prevent outside influences from compromising clinical decisions. Question 32. A social worker is planning an intervention for a family with a school-aged child who has recently begun to exhibit behavioral problems. Applying systems theory, the social worker learns that the parents frequently disagree on discipline but present a unified front to the child, leading to covert conflict. The social worker should focus the intervention on improving the clarity of the families.
A.
Hierarchy, B. differentiation of self, C. boundaries, D. homeostasis. Answer: C. Boundaries. This question tests the application of family systems theory concepts to intervention, focusing on the dynamic of covert conflict and disagreeing on discipline. In systems theory, boundaries are the rules that govern who participates and how they interact. When parents disagree but hide the conflict, covert conflict, the boundary between the parental subsystem is diffuse, unclear, or enmeshed regarding their disagreements, and the boundary with the child is too rigid in their unified front. The intervention must focus on clarifying the spousal boundary so they can resolve their disagreements openly, then present a truly unified, clear, and consistent boundary to the child. The key takeaway is that disagreement among parents that is hidden or inconsistent is a problem with the parental subsystem's boundaries. Question 33. Which of the following is the best example of a social worker utilizing the task of delineating the contract in the initial phase of task-centered practice?
A.
Discussing the client's historical trauma and its root causes. B. Collaboratively creating a problem statement and a set of concrete, time-limited tasks. C. Exploring the client's personal strengths and resources in their community. D. Administering a standardized, objective assessment tool to gather baseline data. Answer: B. Collaboratively creating a problem statement and a set of concrete, time-limited tasks. This question tests knowledge of the core components of task-centered practice, TCP. The keyword delineating the contract refers to the initial agreement between the social worker and the client, which is centered on the specific problems to be worked on and the actions, tasks, to solve them. Therefore, the best answer must involve defining the problem and outlining the client's responsibilities, which are the time-limited, concrete tasks. TCP is highly structured and focuses on the client's actions rather than historical insight. The takeaway is that in task-centered practice, the contract is explicitly defined by the agreed-upon problems and the tasks to address them. Question 34. A social worker is preparing to terminate services with a client who has successfully achieved their goals. The client states, "I'm going to miss you so much. You're the only person who has ever truly understood me." The social worker should recognize this statement as an indication of
A.
Countertransference, B. Splitting, C. Positive transference, D. Intellectualization. Answer: C. Positive transference. The concept tested here is transference, and the clue keywords "miss you so much" and "only person who has ever truly understood me" are indicative of the client projecting idealized feelings onto the social worker. Transference occurs when a client unconsciously and inappropriately redirects feelings and attitudes from an important past relationship, often a parent, onto the social worker. This all-good idealization is a clear example of positive transference, which must be addressed during termination by helping the client recognize their own strengths that allowed for success. The easy way to remember this is that transference is the client's unconscious projection of feelings from the past onto the worker in the present. Question 35. A social worker is reviewing the agency's policy on client data security in light of the 2025 ASWB updates emphasizing ethical technology use. The policy requires all electronic client data to be stored on an encrypted server and only accessible via two-factor authentication. This policy best addresses the ethical principle of
A.
Client self-determination in decision-making. B. Protection of client information and privacy. C. Promoting the dignity and worth of the person. D. Social worker competency in technical skills. Answer: B. Protection of client information and privacy. This question addresses the ethical use of technology, a critical area in recent ASWB updates, with a focus on data security. The keywords encrypted server, accessible via two-factor authentication, and client data all relate directly to securing private information. This policy is a fundamental method of upholding the ethical principle of confidentiality and privacy by implementing security measures to safeguard protected health information, PHI, from unauthorized access. The key takeaway is that encryption and two-factor authentication are the main technological tools for ensuring client privacy in the modern era.